Welcome to Let's Talk Nourishment, where we go beyond food and into the habits that truly nourish. I'm Abigail Parker, nutritional therapy practitioner, here to help you simplify wellness. Today, we're going to be looking at nourishment from a physical perspective, not so much the foods that you're eating. We're going to, of course, include that a little bit in this conversation, I think, too. But it's going to be a lot about how you're physically nourishing your body. And I'm actually looking forward to learning along with you listening today. So I have a guest with me. Dr. Brad Polen is joining me for our conversation today. He is a current PhD student in exercise science at Concordia University in Chicago and a graduate of Logan University, where he earned his Doctor of Chiropractic degree. Since founding Superior Chiropractic and Rehab in 2021, he has been in private practice, specializing in evidence-based, non-invasive care. Following his doctoral training, Dr. Brad began teaching at both St. Louis University School of Medicine and St. Louis College of Health Careers, where he educates future medical and nursing professionals. As a chiropractor and educator, he brings the same passion for teaching into his clinic, empowering patients with a clear understanding of their condition and how conservative care may help them recover without the need for drugs or surgery, which is awesome. So, Dr. Brad, I'm excited to have you here today.
Howdy, howdy. I'm excited to talk to you too, Abigail. I've had this penciled on the calendar for a couple of days now, so I'm real thrilled to be here. Thanks so much.
Oh, it's my pleasure. We've had lots of great conversations behind the scenes prior to even talking about doing a podcast. So the fact that we get to actually have a conversation and put it out into the world now for people to learn is going to be really cool. And I have that last line in your bio that I really just struck a chord for me about helping recover without the need for drugs or surgery. And I think that is such a good starting point to get into is the role of movement in healing.
Yeah, I mean, I don't. So, a big thing with movement is the American College of Sports Medicine had this big position statement. It's almost 20 years ago now. And they mentioned the phrase movement is medicine. And a lot of studies have come out since then, really backing that up. So, one of the big pioneering ones was looking at folks who had like diabetes per se. And they looked at some folks who did exercise and diet alone, and with drug medication like metformin. And they found that those who incorporate both exercise and diet had a highest chance of reducing the blood sugar long term and to keep it from coming back up as well after a 10-year follow-up. That's just one of the many thousands of examples of how physical activity can really be used as a new form of medicine nowadays without going to the doctor and taking some sort of pill with the laundry list of side effects that you see on all the commercials, and how it can really turn your life around very, very quickly too, in a matter of 3 months with consistency. So yeah, I mean, the power of physical activity, it's not to be undersold for sure.
I know, which is something that people don't necessarily think about, how the little habits that you're doing each and every day are actually making you. That's where your health really comes from. It's not about all of a sudden you need to take something in order to get back to a healthy place. Like, you get to make the decision each and every day to take care of yourself. So being able to do this preventative care, or even when you reach a point that something does go wrong, you can potentially have this new form of movement to support you, is really huge. And that's really something, even I've had some care from you that I found to be really unique about going to, which was awesome, is the fact that you do include so much movement. You don't just treat your patients. You don't just have them, lay on the table and crack their backs. It's actually like, hey, we're going to head over into this room and I'm going to talk to you about movement that you can do every day in order to strengthen your spine or whatever it be, help your joint pain, that makes it so that you can start to feel better on your own time too, and not just have to rely on me.
Yeah, I mean, you're right on the money with that, because at least from my practice, my biggest thing here is that if I don't get you better within at least 3 months maximum, I'm not doing my job efficiently. So, in order for you, once you graduate, you have to do quite a few tests movement wise. You have to, and it sounds silly, but we have you go through like a baby progression. So, a lot of people look at movement and they really try to overcomplicate it, but it's not. It doesn't have to go into that level of detail. We teach you how to breathe properly through your belly. We call that diaphragmatic breathing. And then we teach you how to roll from your back to your belly. And then before you know it, you're getting up onto your hands and knees, onto your feet. You're squatting, you're deadlifting, you're lunging, you're hinging. You're doing all these different movements that you do on a day to day basis that a lot of people think that are actually going to hurt my back. To give you an example, I'm treating a patient right now who hurt his low back from deadlifting, and we have to introduce him back to deadlifting because that's something that he knows, likes, and does, not just at the gym, but when he bend down to pick up groceries, he's essentially deadlifting using his hips to hinge forward. And the craziest things happening right now is that every time they see like a little deadlifting platform, they start getting back pain. So we're trying to overcome that psychological barrier with folks too. But to get back to your point, when we look at movement overall, movement is a umbrella term, if you will. So we have physical activity, and physical activity is any sort of like non-planned movement. An example of that is I'm just going to go on a walk. You have no time that you want to finish your walk. You don't have a distance that you want to walk. You're just going to go out and enjoy the sunshine. Well, exercise is something that is structured, it's planned, and there's a goal in place with it. So you're going to go on a walk. I'm going to walk 2 miles in 10 minutes. That, I mean, that's like sprinting almost. But, anyways, so that's kind of like the difference about people think of. And one thing we just need people to do nowadays is more just to move around and be physically active and not overcomplicate it. I mean, I'd love to give your perspective on it from working with your clientele. Have you noticed a lot of your patients don't necessarily meet those physical activity guidelines, and that's what's maybe them seeking to you as well?
It's absolutely something that I talk about with every client is the
Hmm.
difference that you just said between movement and exercise. Because when you say you should exercise more, people are automatically thinking about all the things they hate. I don't want to do push-ups. I don't want to have to go to the gym. But when you put it into this perspective of movement, just moving your body more, being more active, it sounds much more manageable. Like even you're vacuuming your house, though that's moving your body. I know I have a client who is not great at exercising, but she's really good at moving consistently all day long. Whether that's she's out running errands or she's cleaning the house or she's watching her grandson. She's not just sitting, which is something that we can get very caught up in now because you're going to work in an office and you're sitting at a chair all day. And then you're coming home and maybe you're cooking dinner, but then you're tired from working all day. And so you're sitting on the couch. And so it's very easy to just sit all day long, but you get to move your body more and you get to feel better just by doing little things.
Yeah, and that's essentially like a compounding interest approach that I have that I tell my patients all the time is one thing, and they always look at me like I have five heads when I tell them this stat. Is like I could tell them three things after they get done with their first treatment. One, you're going to be sore the next day, and that's expected. You can put ice or heat on it, whichever one makes you feel better. It really doesn't matter. Two, I need you to drink at least half your body weight in fluid ounces. You can do more than that if you're being quite physically active as well. And the last one is I need you to stay active. And they usually look at me like I'm crazy when I say that because they're like, well, when I'm active, this it makes my pain worse. And I always tell them, think of this as like a door hinge. Okay. If you have a door hinge that's rusty and you try to move it back and forth, it's going to squeak because there's a ton of friction there. In a lot of our joints in the body, particularly in the musculoskeletal system on the appendicular skeleton area, those are what's called synovial joints, and they have like this little fluid inside of them that helps lubricate the joint. And the only way that can be activated is with movement. You have to get up and move it. So, even though it hurts initially when you first start, the more that you move, you're lubricating that joint, and we call that motion is lotion. You're basically loosening up that joint the more that you move it. I mean, that's one of the main reasons why a lot of my patients, they love the adjustment, which is great. But I also need them to be moving their joints on their own as well to help reduce their pain. Um, and you've even said it as well. Like you can do something that you absolutely love. You don't have to do something that you despise. I'll use myself as an example of this. I despise running on the treadmill. You will never, you will never find me on a treadmill. But you'll find me on the trails around our area because we have an awesome bike trail system throughout the county. It's very scenic. The weather's great because the wind's blowing in your face as you're riding. It's much more mentally stimulating. And so, having a game plan for those types of people who resist exercise or physical activity and coming up with a good way to overcome it. I mean, I'm sure you've heard the same thing. Usually people will object to like doing physical activity based on time or money. They feel like they don't have enough time of the day or they need like a so much cash to go to the gym and do something when they can just go on a walk down the street or they can do 10 minutes here, 10 minutes here, 10 minutes here until they make the activity guidelines. So a lot of what you're saying is actually what we typically see out in practice as well. Good point.
And it's so good too to mention that movement and exercise does not have to be forcing anything you don't like.
Mhm.
For me, I used to hate exercise. I was that person where I'm like, I don't want to do anything. And the thing that changed my life was I found yoga. So I got into yoga and I figured out like it was this way to get more in touch with my body. There was something so powerful about learning to have control over how I moved my body. And so that really shifted my mindset to, well, you don't hate exercise. You just hate all the things you tried. You haven't been able to find the thing that you actually like. I think that there's something out there for everyone. And for the majority of my clients, it often is yoga as something that they like. They find that they like stretching and it makes them feel calm, especially if they do it in the evening, or even taking a walk is another thing that's really common for my clients to be like, well, I'm happy to get outside and take a walk. That's something that I don't mind doing.
Yeah, and like you said, something as little as that is going to have drastic effects. Because I mean, you'd be surprised. A lot of people know, like they already know that exercise is good for them, but yet only 20% of the population actually meets the CDC guidelines for physical activity. And then you probably know this, only 1% of the population actually meets the CDC's recommendation for what's considered a healthy diet. So those are like, but overwhelmingly, over 90% of the population knows that it's healthy for me to eat a healthy diet. It's healthy for me to be physically active as well, but yet they don't do it. And that's like a huge thing that as healthcare providers, we have to really educate on patients on the importance of it. Because I'm sure, I mean, if someone comes up to me and says, "Hey, you need to do this because it's important." Okay, that's great and all, but like, why is it important for me? Well, it's going to help your blood pressure and your blood sugar levels. It's going to help out with your cholesterol and all this other host of stuff. But if they don't find it enjoyable too, I mean, they'll probably do it for a little bit, but then they'll get discouraged and then they'll fall off the train tracks, and then it's just that re-educating process all over again. So at least for me, with my patients, is that we do a gradual approach with treatment. So initially, we say, I just need you to be physically active. I don't give them a time frame. I don't give them anything, and I let them basically set the bar. So, for example, we had a new patient who just started with us last week, and I said, I just need you to be physically active. The whole spiel I give people after the first day of treatment. And so when they came back in, it's like, hey, just how'd you do? What'd you end up doing? Oh, I went on about a 2 mile walk. I'm like, oh, okay, that's great. Have you ever thought about maybe trying 2 and a quarter? Yeah, I could probably do that. And then they build their way up that way. And if they
Mhm.
want to go even more intense, like start doing weightlifting exercises or start running instead of walking it, that's at their discretion. And it needs to be that type of approach with physical activity. Um, I mean, I would love to give your approach on what you do with your kind of folks when you get those kind of barriers, because that's definitely going to help me in my private practice.
I mean, it's fascinating because we have the same methods of start where it feels good that you can do it. Like set a goal for yourself where you're like, if I do this, I'm going to feel proud. Like, yes, I did it. And then you keep building from there. Because if you set a goal for yourself that is something really extravagant, where you're like, I hate running and I'm going to go take a mile run today. Okay, well, that's not going to be something that you actually are going to keep up with if you're forcing yourself to run because you think it's something you should be doing. You have to meet yourself where you are and pick something that's like, yeah, I want to do this. And if I can do this, it'll be great. Like drinking water is a huge thing with my clients to help them get to drink more. You mentioned about drinking half of your body weight in ounces, and that's the same approach that I take for all of my clients. And I don't immediately be like, okay, well, if you're only drinking 50 ounces and half of your body weight puts you at 100 ounces, I want you to start drinking 100 ounces. No, I'm going to say, hey, well, you're drinking 50 ounces right now. What feels like a really good goal that if you hit it, it's something that you can do and feel like you accomplished something?
And kind of piggybacking on that, a big thing that I have noticed, and I'm sure you've noticed it as well, is that if we work with like someone who's a very big type A personality, is that they want to analyze everything and they want it to be down to the exact like fluid ounce or milligram or anything of that nature. So to give you an example, I have a patient of mine who was a competitive discus and shot thrower, all American in college, went off to have a professional career, and they're coming to see me for treatment for their back pain. And we're talking about like recovery methods, and they're asking me like, okay, like how many carbs should I have, how many protein, how much fat should I have, how long should I sleep, how long much fluid should I have in my body, and there's data to really back all that up. But what sucks about a lot of the science literature is that it's based on more of a average demographic. And one thing that you and I know most is that everyone's different and not everyone follows the textbook. So what I do with a lot of my people when it comes to like physical activity, recovery, nutrition, kind of what you say, I usually send them your way for one thing, but then two, I also will say, well, how do you feel? What's it feel like to you?
Mhm.
Like, does it feel overwhelming? Does it feel like you're burnt out? Do you feel like you really can't muster up the energy to do something, if you will? And a lot of them will give me some pretty good feedback. And recently here, we've been measuring something in our office called heart rate variability. So to kind of give you an idea what that is, your heart beats at a consistent pace typically. So let's say it's like one beat, two beat, three beat. When we have some variability, it might be like a beat, 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 beat. Like it has different variability, it has a bit of variance to it whenever it beats. And a lot of studies say that the higher that variance, the more relaxed or more recovered that you could potentially be. So, I mean, we did something with that when we started looking at like correlations between heart rate variability and how someone feels regarding just the overall recovery. And we're noticing a very positive trend in that direction that the higher the heart rate variability, the more recovered somebody is. But we're not measuring anything in particular. Like we're not measuring sleep, we're not measuring nutrition, we're not measuring hydration. It's just more of how they overall feel. And so, I mean, I know you probably know this already, but there's a big just psychological component to them whenever we have our patients of view physical activity. Do they feel like, man, I'm so burnt out, I just feel like I can't even go on a 10-minute walk? Or if they've had a really, exciting day, not so stressful, maybe they can muster up the courage to do something like that. What are your thoughts on that? Have you seen that in your own practice?
I think it's interesting because that's the whole thing with moving your body is you should feel more energized. You should be in a better mood after you do it. So if you're not, then you're clearly not doing the right thing for you. Or maybe your body's not at a place that it can handle that even. Getting this idea of paying attention to how you feel is huge. That's the entire premise of when I work with a client is getting in touch with your own body. Like you don't need to look for outside sources on what you should be doing, how much you should be eating, what foods you should be eating. You get to figure that out by listening to your own body. And so people that'll tell me like, well, I stretched, but I didn't feel anything after. It wasn't anything that I thought was worthwhile. It's like, okay, well, clearly then this is not the right thing for you to be doing. We need to find something else that actually you notice a difference and makes it worthwhile.
Yeah, and can even piggyback up on that, a lot of folks when they go through some sort of program that involves physical activity, I always encourage them to say, like, the first couple of sessions, you're not really going to notice that big of a difference, and that's going to be normal. What you're going to start noticing are going to be things around the house that you just took for granted, and then you're going to notice a difference in that respect. So, what I mean by that, I have a patient who I've been seeing for the past 2 months now. Horrible leg pain, back pain, sciatica. It's classic textbook with that. And you know, we was just having a conversation last week about when we did a progress report with them, and they were saying, um, yeah, I was able to just go up and down the stairs to do laundry like it was nobody's business. And I was thinking to myself, like, well, do you realize when you first started, you were afraid to even go upstairs because it would trigger your back pain and your leg pain? And it was kind of like a light bulb just popped inside of their head. It was like, well, yeah, that's holy cow, that's right. I did have that fear of going up and down the stairs because I thought it was going to cause my back pain and my leg pain as well. So like those kind of things is what I really tell a lot of my folks with is like don't watch the scale like a hawk. You don't need to really be like measuring every fluid ounce you get because that develops some sort of like an obsessive disorder over time if you're so over analyzing, over critical with that kind of stuff. Just listen to your body, go out and do as much as you can that you can tolerate, and the results will follow with time. It might be longer for some, might be shorter for some, but sooner or later you're going to cross that finish line, which is all that matters.
And it's such an important piece to be able to say where you were versus where you are now, because it's very easy to get caught up feeling like you're not making any progress. But when you have somebody like you who's actually making a point to pay attention every single time I came to you, it was a check in like, hey, what's your pain on a scale of 1 to 10 today? It's actually noting the progress you're making so you can look back whenever these little things happen. Like for me, I had one day where I was like, I reached down and I touched my toes more than I've been able to. You don't pay attention to these little details often enough. It's easy to miss them unless you have somebody actually there to be like, hey, well, before you had told me.
Yeah. And that's the big thing is it's more of a self-discovering journey for I mean a lot of people that I work with, but I know it's a lot of people that you work with too, and their goals and aspirations that they want to accomplish as well. But I mean, of course, there's the big ones that they come to you and talk to you about, but those little ones, they become like a snowball effect. It's usually one, then it gets bigger, then they accomplish another one, and it just kind of gets bigger and bigger as it goes further down the hill. Yeah, you're right on the money with that.
Yes. And so, how do you find is best to help your patients stay consistent long term then? Because something that I appreciate is you mentioned right off the bat, like, I want the people who are coming to me to feel better within 3 months. Like, your job is to then keep up maintenance wise so they continue feeling better. But ultimately, your job is to help them feel better. You don't want people to have to keep coming to you because they're staying where they are. They're going to improve, but then how do you set them up for success so they continue along that path of improvement?
Yeah, great question. So a big thing we do is we do it in two folds. One, we always guide them towards some sort of personal trainer once they're done with treatment with us, because their fitness journey doesn't end with me. They need to continue doing some form of physical activity. And from my experience, a lot of it requires some form of accountability partner. And having a personal trainer is just a great example of that too. In addition to that, too, we also will do check-ins once a month with a lot of the people. So what that looks like is we'll send them a text message, be like, "Hey, just checking in to see how things are going. It's been about a month since I last saw you. We want to make sure you have had no nasty flare-ups. So if you need to get in for a quick treatment session, something of that nature." And then also we also give them structured exercises that have worked really well during the rehab program with us, that if they do get a really nasty flare up, I want them to try these exercises first. And that the exercises don't work well or it doesn't really do much, then give us a shout, see what we can do to help. But of course, nutrition is a big part of that as well, because if you're not fueling your body with the right ingredients, you're essentially going to prolong the issue, or you could potentially just make it worse overall. I mean, I know a lot of my patients who have autoimmune conditions right now, and their diets are just horrendous. And if they were to even consider having like a piece of kale or blueberries or something like that, it would, I mean, just that alone would make a big improvement in their lifespan too. Which is why I have folks like you, and I have another dietitian who I work with really well, who I can really steer a lot of my patients towards, which is a great resource for me.
Yeah, because the fact that the way you're fueling your body with the food is what essentially is allowing you to move every day. And so it is huge. We can think of food as either helping or hurting you, if you want to put it bluntly. Maybe it's not hurting you right now, but it could be down the road even. You're not just eating for today, you're eating for how you're going to feel tomorrow. And so that's where I'm a huge fan of just focusing on little things like adding more fresh foods into your diet. It doesn't have to be anything complicated, but with it being August, it's still summertime and there's so many fresh foods available with farmers markets going on that it makes it a lot easier to eat better and be able to reduce any inflammation in your body when you're just choosing to have these foods that are fresh and in season.
Yeah, I mean that's a huge part of it, because one thing when I was going through my training, we've always viewed as nutrition as a way as like building the temple inside your body. Like you have to exercise to maintain the foundation, fix the cracks and whatnot. But what makes the crack, like glues the cracks together is a lot of the nutritional stuff that you bring in to your body. Like, would you want to spend like $1.50 on this cheap kind of glue that really doesn't do a whole lot, or would you want to spend the more expensive glue right here, right now, but and that expensive glue is going to hold up long term? And one thing I always tell my patients too, like you have usually one or two choices you could suffer. You could suffer by exercising, having a healthy diet, but you have really great longevity of your life, or you can neglect your body and suffer in the long term when you're potentially not as mobile as you'd like to be when you're in your 60s, 70s, and 80s. Like for me, example, it was actually a really interesting case study when I was going through training. I had one grandfather, very active, healthy diet, watched it like a hawk. I had another grandfather who didn't really pay too much about his lifestyle and whatnot. And it was just one was very independent, could still walk, could still do whatever he loved to do, went to all the dancing competitions and whatnot. While I had another grandfather who needed help mowing the yard because he didn't have the physical capacity to do it. He neglected his body. So those types of things are going to really be compounding interest, like I mentioned earlier during our conversation. What you do to your body today is going to drastically affect what happens to it tomorrow.
Mhm.
And a lot of people just don't really view it as that. They view it as like they want immediate gratification, but the human body doesn't work that way. Like somebody expects if they have a caloric deficit by 250 or 500 kilocalories in one day, that they're going to drop 10 pounds. It just doesn't work that way. It takes time and consistency. And so with the consistency with thing, to go back to your second question with me, is education. Educating the patient, educating the client on these are the steps that's going to be. It's not going to be a sprint, it's going to be a marathon. Just like with treatment with me, it's going to take time, but we have milestones that we expect to see. Maybe a pound a week that we try to lose, or 2 pounds a week every in a month. Pardon me. So those types of things are the type of goals that we look at, but we never make them to the point that they're impossible. If we make them impossible, then if the person doesn't meet them, then they can easily fall off the wagon very, very fast, and it can spiral really down and out of control. And what I mean by like an impossible goal is saying that you lose like 5 pounds in a week. that's really, really tough to do without your body going into shock to a certain degree.
Yes, there is the phrase joy in the journey. It's not about the destination. And it's so true. And even you can get very caught up in this idea of you wake up one day and all of a sudden you realize, whatever your struggle is, where, oh my goodness, my knees hurt so bad, or oh my goodness, I cannot believe how overweight I am. And it seems like it just happened overnight whenever your eyes are opened up to the problem. But that's not the case. The case is it actually took time to get there. And so it takes time then to get to a place different where you now want to be. And so instead of looking at it as I'm not happy where I'm at and I'm not going to be happy until I reach that point that I've decided, you get to choose to be happy now that you have made the decision to take care of yourself, that you want to be a better version of yourself, and enjoy every step of the way that you're getting there. Every time you hit a goal, that's something worth celebrating, and even setting up some sort of celebration for yourself whenever you reach your goal so that it is actually joy in the journey.
Yeah, I mean, you're right on the money because what I always tell my folks is you need to celebrate even the big wins and the small wins as well. If you're able to, go on a 2 mile run nonstop and you finish within, let's say, 20 minutes, and you've never done that before, you should reward yourself. I don't I don't know if have you ever, if you don't mind me asking, have you ever played sports when you were back in high school?
I did.
So I did too. So whenever I used to play high school ball, our coaches used physical activity as a punishment. So what I mean by that is we had something called the breakfast club. So if we were late to practice by like 5, 10 minutes or whatever, the next morning we would have to run a mile. And we call that the breakfast club. So that really, like, if you're exposed to physical activity and exercise as a form of punishment and a negative viewpoint, I mean, that's a real tough thing to overcome. And so trying to break that psychological barrier is another huge thing that we do with our folks too. And so kind of piggybacking on what you're saying too, like it is a journey, but if that journey has been a nightmare for you since day one, we need to do some sort of rewiring inside of your brain to say, no, 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 no. This is like me time. This is therapy. This is relaxation mode for you. This is what we want it to be. We don't need it to be in a form of punishment that you did something wrong that day, so you have to go on a 2 mile walk or a 2 mile jog. And a lot of people usually get those types of emotions mixed inside of their head because of the negative association they've had since as they were growing up.
Yes, that is such a good point. Going back to high school, you're right. Thinking about, well, you have to run laps, and it even can be that way where you get associated with food as you have to earn your food. If you had a bad day of eating, well, now I have to, run an extra mile on the treadmill at the gym in order to burn off those calories I just ate. And that's absolutely not the case. You don't have to earn your food. It's not that you're worth anything when it comes to food. Like, you get to use food as fuel for your body, and movement is the same way. You get to move your body and take care of yourself. And I think often of people who will say, like, you don't realize how good you have it until you lose whatever. So thinking about somebody who has lost a leg, it's a dramatic example, but that person who loses a leg suddenly realizes what they took for granted, essentially, with being able to just go on a walk. And so you don't need a big experience, something bad to happen like that, in order for you to appreciate what you have right now.
Yeah, I mean you're right on the money with that. And that's a big thing, kind of piggybacking again on what you're saying, is that if you've ever had that negative association to physical activity, there are strategies to overcome it. It takes a little bit longer than someone who hasn't, of course. But overall, though, we need to get your body moving. And then, of course, you need to replenish it and nourish it with the proper types of food to make sure that it's constantly growing and getting stronger and faster, because your lifestyle doesn't ever slow down. And so your physical activity and your food is going to help make sure you keep up with that lifestyle.
Yes, this idea of holistic health, that it's not just one thing that you need to do. It's not that you need to just go get a pill and that's going to, be the magic for fixing your problems. It is about the little things each and every day. The food that you're eating, how you're moving your body, managing your stress, drinking water. It really does not have to be an overhaul to your life in order to improve it. It's just paying attention to how can I be a better person tomorrow?
Yeah, and that's the big thing because so when like during my training, we had this like little pyramid thing in one of our books. And at the very bottom, it was like, and it's talking about like how to deal with pain per se. At the very bottom, it's just talking about just talking about it, getting it out there, out of your head, talking about it with a practitioner or clinician. Then the next phase was food and exercise. How can you use food and exercise as a form of medicine to help reduce your chronic pain? And then after that, it goes to like different modalities and such as like muscle stim traction, and then it goes to like joint manipulation, and then it goes to pills and surgeries as the most conservative at the bottom, most aggressive at the top. And not to say like medication and surgery don't have it placed. There are certain scenarios when that definitely would be the best option. But if we can help overcome something more naturally with the form of diet, exercise, if you will, it's much more cost effective. It's healthier for you. It has more pros than cons. I say we give that a shot before we go underneath the knife for anything, if that case.
Yes. And it makes me think about, what would you say to somebody who is concerned about, needing care, like if something bad happens, but otherwise they don't really take good care of themselves, thinking about how do you get somebody to decide to, eat better in my case, or for you, it's how do you get somebody to understand the need for chiropractic care before it's reached a point where, oh my goodness, I threw out my back and I can't move, and now I have to go to the chiropractor.
Yeah, good question. A big one is always a constant education and invite. Usually in my field, people tried everything underneath the sun before seeing a chiropractor, which is what it is, unfortunately. But a big thing we're seeing right now is that when we have patients coming to our door, the amount of education that we give them is huge, that they just don't typically expect or get from any other healthcare provider. So to kind of give you an idea of like what we do in our office is that when we have a patient come in, we'll do an examination, we'll talk to them about what's going on, and then the next time they come in is what we call the report of findings. We basically pull up like this big anatomy app and we show them exactly what the issue is, how it's causing their issues, and what steps that we're going to take step by step from a treatment plan perspective on how we can overcome this obstacle. I always tell people a goal without a plan is a wish. So we want to have a plan in place with you so that when we start reaching these milestones, or even if we take a direction in the opposite way, we follow the plan, we're still going to continue getting good results. I mean, it's just like anything else in life. There are going to be hills and valleys, not just with treatment, but also on your wellness journey, your mental health journey, your fitness, your nutrition journey. You're going to have some really great days when you're going to have a lot of big hills. Then you might take a step back and have a valley, but you got to go right back up that hill, and those valleys get smaller and smaller and smaller until it's just a flat line of the hill that you're on. So that's how we kind of classify it to our folks is when they're starting this journey, we have realistic expectations of them. It's going to be a marathon. It's not going to be a sprint. There's going to be more valleys than hills initially, but we celebrate the hills and we get you out of the valley as quick as we can. Before you know it, we're celebrating more hills and those valleys get smaller and smaller and smaller.
You can't have the good days without the bad, as hard as it is to think about, but it really is such a beautiful thing that when you go through those valleys, the hills are so much better than they would be if that was everyday life. And essentially that's what you help people get to, though, is that you're going to have more of those hills, like you said, and the valleys aren't as big of a deal.
Yeah. Yeah, you're right on the money with that. Well said.
So You are at Superior Chiropractic and Rehab in Glen Carbon. If somebody is interested in connecting with you or getting to come and have a conversation with you about their care, how is the best way for them to reach out?
Yeah, so they could find me in one of three ways. They can call and text their office number at 618-844-1993, 618-844-1993. If you try to call or text me, I might be with a patient. You'll get a message saying I'll get back to you as quick as I can. You could send me a message on Instagram if you want at Dr. Brad Polen DC. That's at Dr. Brad Polen DC. And the last one is just go to our website at superiorchiropracticandrehab.com. It has a ton of information on there about what we do, how we help people, all the different types of treatment modalities we utilize. And then you can schedule a new patient appointment that way or by texting, calling, or via Instagram as well.
Awesome. I love so many different ways to be able to get in touch with you. So, works for everybody. And definitely, if you are interested in chiropractic care and maybe you haven't been sure of who to go to, or if you have some sort of physical ailment going on, something that's been bothering you, don't wait and put it off, because we know if you keep putting it off, it's just going to continue to bug you and potentially get worse. So I highly recommend checking him out and hearing what he has to say. Definitely, his consultations are even great because, I'm not that I know a lot about movement in the body, but it was really cool that you taught me some new things in our initial conversation too that I didn't realize about my body. So it was really great, and where I'm able to be like, yes, I recommend going and talking to you. So
Well, cool. I appreciate the shout out. Thank you.
oh, yeah. So this was a really cool conversation, getting to talk about how movement plays such a big role in your health, more than you realize. And I love the phrase, just a body in motion stays in motion. And if you can make it easier to move your body, then what a way to improve overall the joy and the fulfillment you're going to get out of a longer life. So wonderful. Is there anything else that you'd like to add before we wrap up?
No, I appreciate you taking time out of your busy day to get us connected and to do this. I've been looking forward to it. So it's been great. Thanks so much.
Oh, I'm happy that you were able to come, and I am hopeful that if you're listening, you have something wonderful to walk away with.